T. So this is really reiterating the same points that were made by Dr. Nori and Dr. Aurora, but it really emphasizes one important lesson, which is COVID-19 treatment is not a one-size-fits-all. It depends where your patient is along the spectrum as to what you use, because something that might work well in one stage may be harmful in another stage, and that was the point that Dr. Aurora was making, and I would completely agree with that point. So the reason I put this up is your patients will range from asymptomatic, pre-symptomatic, where they have a positive test but have no symptoms, to mild or moderate illness where they have some symptoms but don't yet have evidence of hypoxia, to severe disease when they have hypoxia and extensive lung infiltrates, to critical disease. And the reason why that's important is we think that what's driving those phases differs. We think that viral replication is driving mild to moderate disease, and therefore antivirals like those antibodies that Dr. Nori was talking about is most likely to be effective predominantly in mild to moderate disease in high-risk patients, or as she said, in people who have some immune compromising illness. The severe disease, critical illness, even though inflammation appears to start early, the benefit is of dexamethasone and all the anti-inflammatories is essentially once you're hypoxic. And that's why it's critical to not give dexamethasone to someone who's not hypoxic. And unfortunately, I think we all heard stories where patients were getting dexamethasone and other steroids when they were not yet hypoxic, and I do agree that that's harmful. The recovery trial, the one that established the role of dexamethasone, in the people who weren't hypoxic but were in the hospital in the UK, those people who got dexamethasone were the ones who had a higher mortality. It wasn't statistically significant, but the trend was in the wrong direction. It was really only once you were on oxygen, and particularly when you were critically ill, that people began to benefit. So let me take this slide down now, just to try to answer your question. So those are the two dimensions I think of. How severe is the disease and what is your intervention? Is it an antiviral, like an antibody, or is it an anti-inflammatory?